Thank you very much, Levi. It's great to be here in front of such a great group of people to be able to talk directly to what we in community control organisations actually need in data right now. We have challenges with this all the time. So today we're just going to go through some different sort of types of data and scenarios that we really need right now, and also our sort of vision for the future. So at ARDC Brisbane, our vision for the future is to deliver healthy, connected, Indigenous urban communities. And to do that effectively, as a service delivery organisation, we need data. So we look after the whole holistic service delivery from end to end, from early years, mums and bubs, kindergartens, youth service, medical clinics, mental health, child protection, housing services, family support and aged care. And as you can imagine, with that sort of breadth of service delivery, there's a lot of different data requirements. And so instead of sitting here and listing sort of everything we need, I know I could do that. I can list a couple. We really need health data, we need NDIS data, but what we really need is data to understand impact and outcomes, and we actually need extra access to our own data. So just a little bit more in detail, the health data, we really need to understand outpatient data disaggregated by Indigenous status and location by LGA, by SA2, even SA3 would be even better. NDIS data, same thing. We need to understand, we need to have data disaggregated by Indigenous status. We can't get access to that right now, and it doesn't give us anything. Same goes for corrections data. For example, we can't find out how many Indigenous young people are in the Brisbane watch house at any time. We can't get that. Education and development is really important. The ARDC data isn't disaggregated by Indigenous status as well, so we can't use that to develop service delivery performance plans and then just understand and inform strategy and decision making for the organisation. And so then we've got challenges across the board to get these full disaggregated data sets at local, state and federal levels. And then finally, we have access to systems that are mandated by government, that part of the funding agreement we need to use that system, but we can't programmatically get that data out of that system. So that really adds challenges to, as you've seen over the last couple of days, that we're developing an automated integrated data environment, and when we can't programmatically get that data out of a system that we're mandated to use, it adds massive challenges. There is some progress here for us. Just recently we've been given access to the AIR COVID-19 vaccination data portal, which does have data disaggregated by Indigenous status and LGA. So in practice, that means we can look at our strategy around COVID vaccination in our area. We can see the areas where are performing better and not as well, which has a direct impact on our ability to deliver service. So we need more access to disaggregated data by Indigenous status. We need more access to social and health outcomes data. But most importantly, we need formalised pathways to access this data, and we need collaboration with government to establish these pathways and data access so that we can, the biggest challenge for us outside of the actual deaggregated data access is the pathways to get access to that data. Who has it? Where is it? Who's responsible? So who do we talk to get that data? So just for us, some reflections are, how can we formalise these access pathways? What questions should we be asking, the government specifically? And how do we build capability on both sides to be able to deliver this data? So we need capability built on government side, and I've been spoken about a couple of times in the last couple of days. And I think it's really important that capability is built on government side to understand the data that we need as a community controlled organisation to be able to deliver that service.
Okay, hi everyone, my name's Christine. And today I'm going to be sharing the perspective from Binarri Binyja Yarrwoo Aboriginal Corporation, which is the backbone for empowered communities in the East Kimberley, and how we use and need data for shared decision-making purposes. So Empowered Communities East Kimberley is a collection of organisations in the East Kimberley region. We're based, our office, BBY's office is based in Ngaanyatjarra, which is on Mirrawong country. We're 27 ACRO member organisations throughout the region working together for Aboriginal-led reform. Empowered Communities is a place-based collective impact initiative, and it represents a different way of working with government. It's underpinned by the principles of development, productivity and empowerment, and leaders across Australia are working in partnership with government to change the way that Aboriginal policy is designed and delivered. And it's operating in 10 regions across Australia. Our next presenter, Gary, is in another region. And in the East Kimberley, it was set up in 2016. That's when BBY was established as the backbone organisation. And we're responsible for supporting the implementation of empowered communities by providing Secretariat support and advocacy for the 27 member orgs in our region. So as the backbone organisation for EC in the East Kimberley, we've got a core function to obtain, collate and communicate useful and relevant data to our members, partners and decision makers. So the things that we do with data include trying to get accurate baseline data for the population in the region, doing analysis of current systems and services, mapping and tracking government investment, pinpoint that to talk about, analysis of readily available regional and local data, also pinpoint that, building of frameworks to fill essential data and evidence gaps, and providing a data service where we invite our member organisations to come to us as a backbone organisation to sort out any data requests that they might have. So they might have questions around how to access certain statistics or how to approach a certain data problem, and we do our best to support them with that. So joint decision-making is a little case study that I wanted to provide you guys as an example of how we do shared decision-making and how we use data in that process. So joint decision-making is the name of the process that we use to do shared decision-making over funding in the National Indigenous Australians Agency's Indigenous Advancement Stream. So NIAA's IAS program for short. So what we do is we get community panels from across the region to assess ceasing contracts against community priorities. East Kimberley leaders then form recommendations based on community panel feedback and reflections and pass those recommendations to NIAA, where they sit down together and make a joint decision around what should happen to that funding. So this has been happening since, I think 2018 it started. Since then, we've assessed $28 million of investment that's coming into the East Kimberley. What it's achieved is, first of all, building the capacity of Aboriginal communities and community members to participate in decision-making and building that stronger community voice. So having opportunities for community members to participate in giving feedback and providing recommendations around the services that are delivered in their communities for themselves and their families. Secondly, investment is more aligned with community priorities. So an example I can give is back in 2018 when we first started off doing joint decision-making, there were 6 different services that were up for assessment. They were all finishing at the same time at the end of that year. They were all to do with children and education, children and schooling contracts. So what we did was work with our member organisations to come up with a Kununurra education strategy. And they come up with 4 key priority areas, including early childhood education, primary to secondary school transition, language and culture being embedded in all programs, and long-term funding, so stopping the ineffective short-term cycles of funding. So with those 4 key priority areas, they recommended that with the funding that was going into those 6 contracts, that all got pooled, double the amount of funding that was going into the Mirrawong Language Nest program that teaches kids Mirrawong language, and that other programs that were around supporting families to support kids in schools to be amalgamated into one intensive family support program to reduce duplication across the community. It's also increased sector collaboration. So in another round, we had 4 different job services programs that were being assessed. They were all doing pretty much the same thing, and community said that they needed to see those organisations, those services working in greater collaboration because we didn't want this fragmented delivery across the community. And that resulted in the establishment of the Kununurra Employment Hub, so one co-location where all 4 of those services delivered from the same place. So one job seeker only had to go to one place to get whatever services they need. They didn't have to go around town and get referred left and right to get the support that they needed. And that was also as a result of community recommendation. We've also been able to move this up to a more regional approach, so in aligning investment with regional priorities. So we're based in the East Kimberley, but we're working with empowered communities in the West Kimberley as well now on the contracts that affects the Kimberley as a whole, so getting more regional voice in the picture. And lastly, but not leastly, we're getting an increasingly wider scope. In the last couple of years, we've been able to include more and more of the remote communities throughout the East Kimberley and making sure that they're also getting a voice into the services that are being delivered in their communities. So what data do we need to support this process? We're constantly advocating for more data access to inform decision-making, not just within the joint decision-making process, which I'm talking about now, but in our wider reform goals. Currently, we get access to the ceasing contract list ahead of June 30 and December 31st each year. So NIAA sends over a list of all the contracts that are finishing up. And that's great. It's great to have that data. We get it by delivery location. We get the funding amounts, the funding terms, all of that. What we would like, though, is access to all of the funding that's coming into the East Kimberley. We want to know how much money is coming in. We want to know where it's being spent, what that's achieving. And something leaders are constantly asking for is how much money is coming into the Kimberley? No one knows. And that's a big problem because we know there's a lot. We also need program outcome data, like Jarryd was just referring to before. So at the moment we receive, so the funder, NIAA in this instance, gives us assessments of each of the ceasing contracts, including performance and outcome data. That's great. That really helps us understand what those programs are achieving. It helps us make that meaningful for community members who are trying to assess whether those services are worthwhile continuing in their communities. What we would like, though, is to understand how all investments are leading to outcomes that align with community priorities. So instead of government-defined KPIs, we actually need to know how those services, how that money being spent is aligning with what community needs and what community wants to see in their development goals. And then the last category is population data. So at the moment, we get access to publicly available data like the rest of us do from the ABS and other sources. And we use that to help build a frame and a context when we're briefing community members around in this process. But what we would like is to be able to access reliable population data at the granularity that reflects the communities in the East Kimberley. How can we go to a remote community and say, this is happening and this is happening? Give us feedback when they can't get the data to show like what the population of that community is doing, how many people are there, how many kids are in the school, the health of that community, etc. This is something that we constantly run up against. The data that we're provided is not granular enough to be meaningful for the communities that we're working with. Other data that we're missing? This is really the most direct ask that I can make. This is our regional development agenda. This is a document that's been developed with East Kimberley Aboriginal leaders across the region, articulating the priorities for the region. This is what we want people to be looking at when they're trying to ask about the priorities of the East Kimberley. This is the appendix So the regional development agenda is available on our website if you want to have a look at it. I've just screenshotted the appendix here, which shows the baseline data that we're trying to get to build a picture of what's happening in the East Kimberley. As you can see, a lot of these boxes are NA. We're trying to get up indicators like what's this proportion of Indigenous Australians aged 15 and over reported that they have lived on their homelands or traditional country. We can get that WA state data for that, but we can't get that below in the East Kimberley region. We can't get it for shires. Another one that we're really keen at looking for is the parenting self-efficacy data. So we know that's a really important indicator for thriving in early childhood, whether parents feel like they're doing a good job or not. We can't get a measurement of that. We don't know how to, but we know that we do want to measure it as an indicator for that particular development domain.
Lynn, can I ask a question? Hey? Can I ask a question?
Oh, we're just going to have questions at the end. Is that okay?
I've got myself and one other presenter, so maybe at the end.
But I can't read the...
Oh, sorry. I'll provide the PowerPoint so that we'll share it with everyone afterwards.
I just wanted to ask a question about Yankunytjatjara and Pitjantjarjara. I got a sister that goes between Pitjantjarjara in Yarrwoo Springs. I suppose you know about that.
Not well.
My sister goes between Pitjantjarjara and Yarrwoo Springs, and she speaks all those languages from Sujuna, Yankunytjatjara, Pitjantjarjara, Ngaanyatjarra, Binyja. All those languages. And if she got paid, she could also, because she speaks a language that's over the border from Western Australia, from that area there, she could, if she got paid, she could work for you to work on those languages that could be sold by you. And is that happening in Brisbane?
So we're based in Ngaanyatjarra, and that is a recommendation that's come up through the joint decision-making process. We're assessing a early childhood service, and that service was working with the elders in that community to provide cultural education to the little ones. And what the community said was that they wanted those elders to get paid for that work. If they're going to be transferring that knowledge as part of a service, they wanted to be remunerated for that.
I can't hear what you're saying, but Marcia, I'll finish with that.
Great, thank you. A point I wanted to make before I wrap up is that data access requires capacity building. It's such an integral part of the work that we're doing. Alongside data sharing processes and agreements, community organisations need commitment and support for capacity building in data presentation and visualisation, interpretation and analysis. So much of the work of joint decision making is receiving spreadsheets, receiving large chunks of data and turning it into something that is meaningful for communities. So doing the analysis and presenting it in a way that people can quickly digest and use to make informed decisions. And that's just in the backbone organisation that we do that, but we want to see that in community orgs as well, in all the other community orgs, I mean. And that capacity building is required on both sides, as we've already discussed over the last 2 days. For community members where English isn't a first language, where literacy and numeracy levels are at basic levels, certain types of data are much more meaningful. And for government departments that want to work meaningfully with communities, you need to understand how to access and present data to enable shared decision making. You need to figure out how you can do that better. So reflections from the East Kimberley are that data access and shared decision making are really two sides of the same coin. Sharing data needs to come with the intention to share decision making. With increased information, there's more opportunities to work in partnership with government to share decision making. And that's something really exciting for us. But also it's so disempowering to share decision making without sharing the data. You can't ask questions of communities without giving them the full picture and informing them in a way that allows them to make proper evidence-based decisions. The questions that we leave you with is how can government share decision-making with Aboriginal communities, but then also how can they share the data to make that happen? Thank you. I'll pass on to Gary.
Hi there. Just want to acknowledge and pay my respect to the Aranda people, whose country I work on here in Mbunwe and Alice Springs, and pay my respect to the Anangu, who I spent a lot of time working on their country across the tri-state region. Picking up from where Jarryd and Christine were, more particularly Christine, I'm going to talk a bit about the MPY in the tri-state region. Now, the MPY Empowered Communities region spans 3 states: Western Australia, the Ngaanyatjarra country, the bottom of the NT, and the APY lands in South Australia. It's a huge area, about 350,000 square kilometres. I think there's about 37 communities in that space, 37 communities and homelands, if you like, of which 26 are fairly significant size communities. About 6,000 people living in that space, so population density similar to Mongolia, parts of Mongolia. A highly mobile population, really strong culture, strong languages in that space. English is a second or third language. And of course, it's trisected by state boundaries and jurisdictions, which complicates the way in which we, I guess, have to deal with government in that space. It's probably apart from the remoteness and the scale, it's the biggest challenge, dealing with 4 governments, not just 1 or 2, as in the state government and the Australian government. We might move on to the next slide.
It goes down to Sojourner as well, and Adelaide now.
Certainly Anangu down in those spaces, that's absolutely right, and a lot of mobility. And as you can imagine from the tri-state region, there's much of the servicing happens from Alice Springs, so that's a minimum 5-hour drive to the nearest part and a day and a half's drive from one end to the other. Serviced in WA from Perth, Adelaide in South Australia, and of course, obviously the federal government's got a link through the Alice Springs office and a connection into Canberra. So just going on to the, I want to mention too, Lisa Barmer is away today. She unfortunately sends her apologies. She had a hand fracture, but I'll just talk a little bit about the MPY Women's Council. It's probably a leader in the provision of services across the MPY tri-state region. It actually provides services across each of those sub-regions, NT, South Australia and WA. It's been delivering health and social cultural services for 40 years in that space. All Anangu-led, complete Anangu board of directors, and engages, as I mentioned, with the Australian, South Australian, WA and NT governments. It covers youth services, domestic and family violence, Jungu or aged and disability services, and Nunkarai, which are healing people, does some social enterprise work through Jumpy Desert Weavers, deals with child and family wellbeing, and of course a very strong advocacy organisation. And one of the key things...
Your map doesn't show connections with Adelaide and Sojourner and points between there and Central Australia.
That's certainly true, but it shows the core of the MPY region so that we get an understanding of how large the span is. All right. Of course, now just going back to that last slide, sorry, Jarryd. And of course, one of the key things about the MPY Women's Council, it's been a leader of reform in the space, particularly in areas of like dealing with family violence, domestic violence, petrol sniffing, substance abuse over the years. A great reform leadership organisation. And part of what they got involved with was auspicing MPY empowered communities. And as Christine mentioned, empowered communities spans 10 regions across Australia. the East Kimberley, West Kimberley, North East Arnhem, MPY, Empowered Communities Region, Far West Coast of South Australia, which you've mentioned, Narrandjeri Lands, Cape York, Inner Sydney, Central Coast in New South Wales and the Golden Murray region. And that, if you like, alliance of Indigenous region, empowered communities regions has been led by Indigenous leaders who've carried reform agendas in each of those regions. They came together in 2013 and, if you like, came together to design and build a new way of working or a new model of working with government to rebalance that relationship so that regions and Aboriginal people were able to make decisions jointly on even terms with government. So traditionally, of course, government's been driving the agendas in this space, and empowered communities have been very much about repositioning that. So it's Indigenous-led reform across those 10 regions. And of course, MPY is one of the key EC regions in that space. So in the empowered community space, closing the gap is the major policy goal. And as Christine mentioned, it's very much centred around an agenda of empowerment, which is about people's agency, exercising their decision-making and agency, and the right to take responsibility. A very much strong focus on development is another theme. People's social, economic and cultural development, not just a focus on service provision in its own right. And a big focus on productivity, that is the best use or spend of money, the most effective and efficient way of spending investment. And of course, as I mentioned yesterday, one of the key principles underlying this is that subsidiarity sort of frames much of the work that happens in the empowered community space, where decision-making is very much about empowering families and individuals and communities in their work. And as I mentioned, it's about rebalancing and the relationship with government and partnering with the government and going forward.
Well, you should tell this young woman that's been giving the information out that your information is available.
I'll move on to the next slide if that's okay. I could just not quite hear all that. So in the MPY Empowered Communities region, as in all the Empowered Communities region, there's a what we call a regional development agenda. And in the MPY region, we call that a regional development roadmap, where it sets out the priorities put forward by Anangu that came out of a fairly extensive engagement process. And as you see in that flower sort of arrangement on the right there, that's about Anangu-led decision-making and community empowerment, work, meaningful engagement and financial security, education, culture, and youth support, housing and infrastructure, keeping safe and caring for the vulnerable at the age, disability and youth. First priorities in this region have been very much about support for Anangu work and more jobs in that context, and school to work transition, achieving better schooling outcomes. Another key area has been the joint decision making that Christine alluded to. Similarly, in the NPY region, there's joint decision making. I think we're up to about 20 odd million over the last 3 or 4 years, where decisions are made jointly with NIAA about the investment of ceasing grants in that region. But what I want to go to today is the regional investment strategy. So the regional development agenda drives what we call a regional investment strategy as well. And apart from driving joint decision making, what we want to do with the investment strategy is ensure that we reflect the priorities that Anangu want in the region, and any investment going forward ultimately takes into account those Anangu priorities and drives the ask for data. So we've got to be very clear about what indeed we're asking for. Underpinning those arrangements, we talked about in a partnership with government. We are working towards a local partnership agreement where it's acknowledged that data is a joint responsibility, and that in going forward we develop an investment data framework which goes to principles of quality, integrity, sovereignty, stewardship, among other things. Now, the ask for data clearly in a region like the MPY region or the Kimberley or whatever, any ask about the total regional investment is big, it's complex, involves many agencies, particularly in the tri-state context where there's 4 governments involved. Christina mentioned the difficulty of getting a picture in the Kimberley where you're dealing with the West Australian and Australian governments. If you add the South Australian, WANT and Australian governments, it's quite a challenge in terms of getting a real picture of the investment in the MPY region. So the MPY approach is to stage the regional investment approach. It's about, first of all, looking at youth, early childhood and infrastructure with particular focus on jobs and pathways and transitions to schooling. So in doing that, we're very much about understanding what that investment is, whether it's demand-driven data, demand-driven investment, whether it's capital, infrastructure, whether it's recurrent funding, discretionary funding, Indigenous or mainstream specific. So pretty complex ask all up. But the approach is to try and stage that. Obviously, we're very keen on understanding the socioeconomic or population data and very much understanding the service and client data.
Capitalism, just that the fact that there are speakers of language that need to indicate.
Keep going, Gary.
Okay, so in doing that, the ask is trying to be very clear about what it is we're trying to achieve and being very clear about the questions. And so recently we've formally tabled an ask with our partnership discussions with NIAA, and of course that'll be the basis of a discussion that we'll take forward with both NIAA, South Australian, WA and Northern Territory governments. So the idea is to get a very sort of staged, methodical approach to this and being very clear about the ask.
Well,
Next.
Brisbane hasn't heard your communication. So my question is, why don't you talk to Brisbane?
We can pick that up later. So just our reflections, have we got the questions right to get the most helpful, usable and relevant regional local data? What is that data? What's in and out of scope? What is the extent of investment data, which I've just touched on? What is the impact or outcomes data that we need to effectively analyse the regional investment planning, and the joint decision making? And a key thing that all of us have in common in terms of this panel is making sure we can get disaggregated local and community-based data. And how do we best safeguard that? So overall, from all of us, I think the common themes here are really is that we need data that's meaningful and that it's disaggregated by Indigenous status and community below the SA2 level. So we're keen to get performance data, the investment data, which I've touched on a lot, population data, socioeconomic data, and how best do we get government to work together with communities to deliver pathways and data access reform.
Thank you, Gary.
Not a rhetorical question.
So we might just open up the room in the roundtable for discussion. We might just check and see if we can kick that discussion off with and check in if there's anyone in the virtual room that might have a question.
There's a question here, which is not virtual yet.
Yep, no, that's okay. We can definitely cross back over to the room. So let me grab my microphone. Yeah, we've got a microphone. It's late in the day. Bear with me, folk.
Thanks very much. I think this was an incredibly important set of presentations, and of course it was very good that you were able to sort of summarise the commonalities between each of these. But I have some real problems with the quality of the data that are collected by the bureaucracy. in the ABS census, not this last one, but the one before that, there was an 18% undercount in the Kimberley. And that's appalling and unacceptable. And so I have a real problem with some of that quality. So this two-way learning has to really, we have to put a lot more requests to governments to actually get serious about Aboriginal data and to really make it of high quality. We haven't talked enough about quality data in this roundtable because it's not worth it if you don't have good quality data. So not only would you have underreporting of people in your population, so requesting that information on your populations in those small areas, you have no idea it's going to be accurate or not. It's in some of the other countries where they don't have such good data, they have to go out and do their own population census if they're going to do any epidemiological studies, for example. And the other thing in terms of talking about the Jarryd's requests for the disaggregated data, I honestly think that it's going to be very difficult just to get disaggregated data for your purposes. And what you really need, and I know it's even harder to get out of government, is linked data. And so that you need to have every individual in the community linked to the health outcomes and the death outcomes and the and so on. The problem with disaggregated data too is that if it's small communities and there are less than 5 people in a cell, they won't give you the data. So it's inaccurate from that point of view. So I really think we have to perhaps raise our aspirations and say, why can't we have linked data with these services and really put a capacity then into to those communities to be able to really analyse what they're doing. I think it's appalling that you get these projects that end after so many years and then you have to reapply. I mean, you need a PhD in bloody grant applications to run some of the local communities, but I think it's not going to help you as much as it could if you could just get the data individually linked and anonymously linked, and then you'd have the whole pattern that you need.
My question sort of builds on that. It comes at it from a slightly different angle. You talked yesterday that you have a small research team, 2 people, I believe. So talking to you, Jarryd, that presumably are there and capable of saying, well, if we don't have the data and we can't get the data, we can make the data. I mean, obviously 2 people is a very small team, it's a big ask, but it's if you had resources to put into saying we've got problems that are data problems in one sense, if we had the resources, would we put them into making data that we need? So in identifying what's needed and then going out there and making it rather than trying to say somebody else needs to make it. So it comes at that same problem slightly differently, but it means that different kinds of knowledges are able to participate in the data making process. So if any reflections on that?
Yeah, actually, totally agree. That is something that we're looking at as well and getting and building our own data. It was mentioned briefly in one of the other QUT presentations. I can't remember if it was yesterday or today, but something else we are looking at ourselves is doing our own Logan census so that we've got accurate data that we've generated ourselves. So that's certainly something that we're looking at, and definitely something that we're considering is utilising the research team to start building out those sort of gaps in our data as well.
I might, Jonah here from Anandale Land Council again, I might just jump in because that's exactly what we're doing at the moment, and we've started doing our own population census on Good Island and our own employment survey and some other stuff. And I was just going to say, yeah, like Fiona was just saying when we were she had another comment there then about maybe it's the other way around and maybe it needs to be bottom up, building data sets. But again, that comes to the question I asked earlier of funding and who funds it, who pays for it and who resources it. So who knows?
I was just going to add, and thank you to Uni Melbourne team, Marcia and Kristen and the team for the support we'll get for the Logan census. I want to acknowledge you all. I guess the other bits that there's bits that we can do ourselves, but there's bits that we just can't. You know, we can't go to the hospitals and what we want to find out. What Jarryd mentioned: outpatient data, inpatient data, that outcome stuff. And I agree that stuff would ideally be linked so that we can get the full picture of what's happening within community. And I guess also see where the gaps are, but also see where the work that we're doing in, say, primary healthcare and sort of that in a holistic sense of looking at the social determinants of health, what impact that's having. And I guess because that should be able to feed back to government to say, hey, the dollars you spend out in community are much better than the dollars you spend within the hospital. So, yeah.
Thank you, Levi. We've got a few comments online. I wonder if we could cross over and ask the online participants to go through those. Aaron Corn, we've got a comment that's come up from you. Are you happy to talk to that?
I could. Look, there are technologies for linking data out there. There are no sort of magic solutions. A lot of it just requires laborious manual data entry to do. If you're dealing with very finite communities in terms of population number, I'd say that investment is probably worth it because then you have a data set that shows those links into the future. And of course, if the communities want that and are okay with that, yeah, that's the only thought I had at the time. But yeah, it is possible to do. And I think for, very finite populations, it may well be worth the investment.
Thank you, Aaron. Bernadette Highland, you have your virtual hand raised. Question or comment?
Thank you. So just a quick question. One, Fiona, thank you so much for your repeated references to linked data. As a former international data standards chair, I love hearing that. And it was very much driven by the public health community 15 years ago. But I have a very genuine question. I had asked it in chat because I've just recently interviewed about 40 senior data champions in Australia and New Zealand who they are the data custodians of certain data sets that I believe this community wants access to. And I have a very genuine question because it was an interesting finding. They revealed that they were embarrassed and they institutionally wanted to keep the data within the institutions. It's not that they don't know how to release it or make it available. Yes, there are some privacy concerns because of lack of the ability to genuinely and truly anonymize data. But it was just, I realized it was a very human emotion. These people were collecting data. Sometimes they've collected it from 30, 40 years ago, and it revealed very shocking and embarrassing things about Aboriginal healthcare. And so how does one deal with these people, some of whom may be in the room, I don't know, who are protecting data sets because of the institutional embarrassment that it will reveal? And it's not may reveal, it will reveal. So they're grappling with that. On one hand, they want to protect the institution and the leaders who made certain decisions. On the other hand, they know inside that they need to release it because some of them are very ethical people and believe that it should be made available. Thank you.
I'll jump in and I'll add my 2 cents on that comment. And I'll start by saying, like, truly to God, there is a point that needs to be stated with that. That's a relevant question. But much when I opened this discussion this afternoon, I also said that it's about being brave. It's about all those things and doing it with the level of humility. If the people that sit in these spaces cannot separate their emotion from what's morally right and what needs to be done, you're part of the problem. And so, like, if you can't separate, because that's the thing, it's just like, we can be human enough and we need to be clever enough to actually say, yes, this is an uncomfortable feeling. Yes, this gives rise to all of these things. Yes, this is an embarrassing reflection on our past, but it's not where our history's, like, it's not where our future's going. And so I think if you actually, like, you know, have enough kindness to yourself and, like, you know, extend that out, like, that should be a non-question. That should be, like, how you guided with these decisions and with, like, because you do, you have a responsibility. And I think, like, that idea of, like, people being emotional in these spaces and being like, oh, yeah, this is really awkward. It's like, no, be better. Be better, because when we're better, when we know better, we always do better. That is such a reiterative thing that we need to just keep telling ourselves. And this idea of being persecuted or being flogged, like, that's okay. Like, people are also kind enough to like, you know what, it's just like, this is, I see you trying. I see you wanting for this to be better. So, like, you just have to have faith. You have to take a leap of faith. It's having that higher risk appetite. And that's what I was saying. The non-Indigenous counterparts in whatever sector, whatever roles you fill, you need to match parity from, like, grassroots upwards. It's not a top-down approach, is not going to work. And I think, like, the discussion over the last couple of days has clearly illustrated that. So, sorry if I feel like really, if that comment and that response was really impassioned, but I just, yeah, that is a really sensitive kind of space for me, because I deal with that all the time.
Yeah. Levi, thank you very much for that response. And I would actually make an ask of you that you would bottle up that passion in a TED Talk and get as many views as Brene Brown has around brave conversations. She's had over 50 million people watch her TED Talk on shame and vulnerability. And I feel that, again, this community has an enormous amount to teach the tech community. And right now there's a deep thirst in both Indigenous and non-Indigenous communities to learn how to do this, how to, it's all well and good to talk about data science and ethics. And I literally popped out because I had to teach a class and came back and I played one of David Lovell's talks on data science and ethics. And the students said, oh, that's really good and important, but I don't know how to do it. And so I think a lot of this comes down to the human psychology of dealing with vulnerability and shame, of finding your voice and saying when you work in a tech company, no, I really don't think this is right or good, and maybe we shouldn't do that. So thank you very much.
He is not Anangu. And being angry at Anangu intervening is the problem.
Thank you, Bernadette. And thank you, Levi, for sharing that. I personally think you'd be great on a TED Talk. And I think we need to see how we could do that if you were interested. We've got some more activity online, Levi. If we could focus on this. Isaac Torres from Cara, you have a comment in the chats. Are you happy to talk about that? Well, there's a question and a comment. Isaac.
Hey, good afternoon, everyone. I'm from Jarryd and Yarrwoo country here in Broome, WA. First of all, thank you, everyone, for the very interesting discussion and presentations, mate. This has been great for me. Just a quick bit about what I'm up to. The Kimberley Aboriginal Health Research Alliance. I'm the data project coordinator, and we're trying to create a linked primary healthcare data platform using de-identified primary healthcare data from our ACHAs and the WA Country Health Service. So it's been very interesting trying to make this project a reality. We're currently in our governance establishment phase and trying to work at Indigenous data sovereignty and access data from government has been very interesting because there's no roadmap, and it doesn't appear that anyone has kind of blazed this trail before. And apologies, I did miss most of the first day because I was actually trying to get my steering committee up and running. So I guess my point is more from the empowered communities. They were talking about kind of like some standardized frameworks for talking to government and accessing data, and that's like something that I'm really, really interested in. And if you've made any progress in that way, I'd be very keen. I do have a catch up with Christine, thank you, when she gets back into WA. So hopefully we've got some good information to share. But if anyone else knows beyond closing the gap agreements and what each state has proposed that they're up to, WA has some really interesting data privacy stuff going on because they don't have an overarching law, and like others, ours is all buried within the Health Act, the Public Health Act, things like that. And so, yeah, everyone I've spoken to about our project is very keen. From what we can tell, what we could achieve with this linked data is, better understanding of our communities than the ABS data, things like that. And the platform will be used for our health planning into the future and also for research purposes. So I believe there's a lot of epidemiologists who think it would be quite a feat if we can pull this off. Once again, thank you, everyone, and look forward to hearing more and hopefully catching up with some of you, because I'd really like to know how your projects are going. Thanks.
I just might make a comment there, if that's all right. What I mentioned was in a number of the EC regions, there's what we call a local partnership agreement or a regional partnership agreement with NIAA. Not all regions have signed off on them, but they're certainly in the MPY region, where it's in a state of near finality. There is a discussion about, or points in there where it talks about joint responsibility in the provision of data, and where we work together on what the data is going forward, with NIAA having a clear sort of responsibility across the Australian government to help us find the data we need. Our hope is that we will extend that to the other jurisdictions in the MPY space, so that, for example, we have a signed statement of intent with the NT government, the Australian government, about some joint activity, including shared data and that. So we're at the edge of sort of trying to put in frameworks, if you like, or ways in which we can get data shared. So as part of that partnership agreement or our arrangements, we also have a what we call a meeting place, or a partnership table, where it's called a Regional Funding and Procurement Working Group, where we have at the table Ananu, the ARCHOs, and the 4 jurisdictions. So we can make decisions about how we frame the data. In fact, we have an investment data framework in draft state with that group, which sets out some of the principles as well. So we are trying to put in place mechanisms, if you like, to try and make the partnership a bit more relaxed about that, make government a bit more relaxed about providing the data. So the partnership arrangement, the negotiating table or meeting place, and the framework for the data itself.
Sophie Lewinkamp, I work for the Ningan project. So I've been thinking about community access to data and linking that back to what Michael said, but also you, Levi, at the beginning of the session. This is access to community language information that sits in libraries and archives. So Ningan project is transcribing early language material, making it accessible, searchable in text form, but we, like the presenters and people have been saying today, we're in a gatekeeper situation of not being able to get access to those manuscripts, but also have them digitised. And I'm interested in what other people think and the support that, I know we're one project, but lots of people have these issues. These manuscripts don't live on country. If they're even known about, people can't access to them. They have they're very early. These are the earliest language manuscripts, so they represent lots of language communities. So even if we could get letters, we don't always know what we are looking at. We represent lots of different people, different communities trying to get access. So there are similar threads, I think, in this sort of health space, and asking big institutions with power, and maybe they don't have the strength, or they're so worried about risk that they're not up for the access challenge.
We just want to say thank you again to the 3 representatives from the community organisations and empowered communities. That was a fantastic session. So thanks very much again.